TYMLOS is a prescription medicine approved to treat postmenopausal women and increase bone density in men with osteoporosis who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. Please see additional important safety information throughout and at the end of this video.
I think there are too many people who don't understand the serious nature of osteoporosis, and I was one of those people. I am Pam, and I grew up in Dallas, but I went to college in West Texas, and I have lived here ever since. I have a husband, Rob. I like collecting things, and I have done lots of antiquing. We have 3 little grandchildren who are 5 and under, and we like to spend as much time with them as possible. When we are with our grandkids, it literally is a 3-ring circus. So keeping up with them is very important to us because we want to be where they are. My treatment journey with osteoporosis has been very challenging. I was very reluctant to admit that there was anything wrong with my bone health. But then, according to my DEXA scans, I was sliding in the wrong direction. I think I was just in denial about there being any issue with my bone health. I had no symptoms. I didn't feel any differently than I did before. In the past, I have worked as a medical scribe, so I was actually in the exam room listening to conversations between the doctor and patients about their osteoporosis treatment. I also actually sat by some bone models, one of which demonstrated severe osteoporosis, and I remember looking at it and thinking, that is so very sad. It wasn't until later that I realized that my bone health actually looked worse than that. At that point, I remember thinking, I have been resisting treatment, and that is probably not a very smart thing to be doing. I'm probably going to have to get on board with this. Even though my doctor had ordered an antiresorptive for me, I was hesitant to start it and wanted to learn more myself. So in my research, I discovered TYMLOS. I talked to my doctor about TYMLOS, and we discussed some of the risks and potential side effects. What my doctor told me about TYMLOS sounded promising, that it could rebuild my bone so that it didn't look like that bone model that I felt sorry for. When it came time to give myself my first injection, I read through the instructions multiple times. I primed my pen, and I knew that I either needed to be seated or lying down, so I sat on the edge of my bed, and I can say that after giving myself my first injection, it was the thought of giving myself an injection that was a bigger deal. Following treatment with TYMLOS, my doctor was pleased with my T-scores. This was my experience with TYMLOS, and other people might have a different experience. People should talk to their doctor and find out if TYMLOS is right for them. After I stopped taking TYMLOS, my doctor chose to put me on a treatment to maintain the improvements I had achieved with TYMLOS. Of course, I'm also following my doctor's instructions about exercise and staying safe from falls. I think it's important for people with osteoporosis at high risk for fracture to get educated and find out what they are really dealing with. I believe that education and communication are key to proactively dealing with osteoporosis. I can tell you that today I feel confident that I can be more active, and that is why my doctor and I chose TYMLOS.
Important safety information and indications. What is the most important information I should know about TYMLOS? TYMLOS may cause serious side effects, including possible bone cancer, osteosarcoma. During animal drug testing, TYMLOS caused some rats to develop a bone cancer called osteosarcoma. It is not known if people who take TYMLOS will have a higher chance of getting osteosarcoma. Tell your healthcare provider right away if you have pain in your bones, pain in any areas of your body that does not go away, or any new or unusual lumps or swelling under your skin that is tender to touch. Do not take TYMLOS if you had an allergic reaction to Abaloparatide or any of the other ingredients in TYMLOS. The inactive ingredients in TYMLOS are phenol, sodium acetate trihydrate, acetic acid, and water for injection. Before you take TYMLOS, tell your healthcare provider about all of your medical conditions, including if you have Paget's disease of the bone or other bone disease, have or have had any of the following: cancer in your bones, radiation therapy involving your bones, too much calcium in your blood, or an increase in your parathyroid hormone, hyperparathyroidism. Will have trouble injecting yourself with a TYMLOS pen and do not have someone who can help you. Are pregnant or plan to become pregnant, because TYMLOS is not for pregnant women. Or if you are breastfeeding or plan to breastfeed, it is not known if TYMLOS passes into your breast milk. You should not take TYMLOS and breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of TYMLOS? TYMLOS can cause serious side effects, including decrease in blood pressure when you change positions. Some people may feel dizzy, have a faster heartbeat, or feel lightheaded soon after the TYMLOS injection is given. These symptoms generally go away within a few hours. Take your injection of TYMLOS in a place where you can sit or lie down right away if you get these symptoms. If your symptoms get worse or do not go away, stop taking TYMLOS and call your healthcare provider. Increased blood calcium, hypercalcemia. TYMLOS can cause some people to have a higher blood calcium level than normal. Your healthcare provider may check your blood calcium before you start and during your treatment with TYMLOS. Tell your healthcare provider if you have nausea, vomiting, constipation, low energy, or muscle weakness. These may be signs there is too much calcium in your blood. Increase urine calcium, hypercalciuria. TYMLOS can cause some people to have higher levels of calcium in their urine than normal. Increased calcium may also cause you to develop kidney stones, urolithiasis, in your kidneys, bladder, or urinary tract. Tell your healthcare provider right away if you get any symptoms of kidney stones, which may include pain in your lower back or lower stomach area, pain when you urinate, or blood in your urine. The most common side effects of TYMLOS in women with postmenopausal osteoporosis include dizziness, nausea, headache, fast heartbeat, feeling tired, fatigue, upper stomach pain, and spinning feeling, vertigo. The most common side effects of TYMLOS in men with osteoporosis include redness at injection site, dizziness, joint pain, swelling at injection site, pain at injection site, bruising, abdominal bloating, diarrhea, nausea, abdominal pain, and bone pain. These are not all the possible side effects of TYMLOS. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. How should I use TYMLOS? Read the complete instructions for use provided with your medicine. If you take more TYMLOS than prescribed, you may experience symptoms such as muscle weakness, low energy, headache, nausea, dizziness, especially when getting up after sitting for a while, and a faster heartbeat. Stop taking TYMLOS and call your healthcare provider right away. You should not use TYMLOS for more than 2 years over your lifetime. What is TYMLOS? TYMLOS is a prescription medicine used to treat osteoporosis in postmenopausal women who are at high risk for bone fracture, or who cannot use another osteoporosis treatment, or other osteoporosis treatments did not work well. TYMLOS can decrease the chance of having a fracture of the spine and other bones in postmenopausal women with thinning and weakening bones, osteoporosis, and increase bone density in men with osteoporosis who are at high risk for bone fracture, or who cannot use another osteoporosis treatment, or other osteoporosis treatments did not work well. It is not known if TYMLOS is safe and effective for children and young adults 18 years and younger. TYMLOS should not be used in children and young adults whose bones are still growing. Please read the full prescribing information, including medication guide, at TYMLOSPI.com.